Madam Chairwoman, thank you very much. For those members that are here, I only see one other in the room that was here in 2008, 9, 10, as we went through this exact same type of hearing about how great the Affordable Care Act would be. And yet you notice no one Democrat that I see talks about how great the Affordable Care Act was, because it wasn't. It took $800 billion out of Medicare. Democrats actually took $800 billion away from seniors to pay for this. Now we have Medicare for all, like it's their newfound answer. Oh, by the way, I heard one of our persons just a minute ago giving testimony about how Medicaid works so well. I wonder why we're not doing Medicaid for all. Well, ladies and gentlemen, the bottom line is that both the House bill and the Senate bill, under Section 107, beginning on the effective date, as in Section 106A, it shall be unlawful for a private insurer to sell health insurance coverage that duplicates the benefits under this act. And it's unlawful for an employer to provide benefits. Well, Mrs. Turner, I recall where it took President Obama several election cycles before they could even tell us, quote, what was in the bill. And it took them a long, long time only to discover that their drawings on a board did not equal success for patients. Why would they want everybody to go into this system that is designed for seniors? It is designed for seniors. It is not designed for children. It is not designed for disabled young adults. As a matter of fact, I have a disabled, at least one in my family, a Down syndrome young man who is my son. They are trying to take all of America and make it to where we would be at the same place 2 years later of trying to say, my gosh, what did we do? Mrs. Turner, I know the gentleman, Dr. Merrill Matthews, well. I know the gentleman, Dr. John Goodman, well. And they have spoken about the excessive impact that this would have. Do you agree with me?
I do, Congressman, and I also agree that we really have to figure out what the problem is we're trying to solve, since 2/3 of people who are uninsured today have access to coverage, they're just not enrolled. So I think we need to look at that specifically. How do we help get people into the system who, for a number of different reasons, are not participating? And we also need to figure out how can we do a better job of delivering specialty care to people with special medical needs, rather than one-size-fits-all standardization, which is ultimately going to work for very few people.
Yeah, Mrs. Turner, when I came to Congress, I had spent 16 years at a small telecommunications company called AT&T. AT&T was prohibited by the law that was passed by Democrats and President Obama that said that they would not allow employers to deduct benefits, money spent on employer-provided health care to retirees. That's against the law. They wanted to move everybody off of an employer-provided model, which seemingly everybody was happy with, and to move to a Medicaid model. The question I would ask you is, do you think that a system, let's say American Airlines or AT&T, that would be the model that we would want everybody to move to, just like employer-provided health care? Because as I read this, I'm a political science major, when the government competes against somebody, free market, that's called socialism. when the government dictates who can be in the marketplace, that's communism. What do you think this is, given that as a choice?
Well, I believe that Medicare for All definitely is a socialized healthcare system.
Why is it socialized? It doesn't allow anybody to compete against it.
Everybody would
Wouldn't that
be
be
in the same
communism?
system. Well,
You may not have been a political
thought
science
of that
major.
term for it, but it certainly, it is a one-size-fits-all program.
It outlaws anyone else from providing coverage. That is communism. I thank the gentlewoman for being here, and I thank the gentlewoman, the chairwoman of the committee, for this hearing today. Thank you.